I know that you do a lot of telemedicine in the ICUs, in addition to your on-site work. How does telemedicine come into play to help hospitals that have fewer resources?
Oh, it's unbelievable. It's unbelievable. I mean, we, to be able to deliver immediate support and the board certified critical care doctor is huge. It means you can, you can cover so many different areas. You can cover so many different regions all simultaneously and providing sort of world-class medicine to them. It's been a godsend. I mean, the problem is that when the big hospitals become inundated, the smaller hospitals can't transfer their patients there. And then there's even smaller, what we call acute access areas, those tiny hospitals that get stuck with a COVID patient on a ventilator, they can't manage them. In addition to that, you have doctors that are working in the larger hospitals, side hospitals. They're burning out. They can't cover it. They just can't do the work. They just can't do it.
Right.
And I had a friend of mine that I called him just to check in on him, and he said he actually took the year off.
He took a year off.
Took a year off. You're one of the best intensivists out there. Why would you take? We need you. And he said, I took the year off because I figured, why do this? It's not even medicine. This is not even what I'm used to. I'll come back a year from now, and hopefully this whole thing will pass. If I do participate, I'm risking burning out, and it's something to be said about that. The emotional toll is unreal.
We don't have so much intensive care telemedicine in Israel, and in general, that would be something that would be very helpful for our healthcare system also, which is to be able to get those critical care physicians, on site through telemedicine to be able to support smaller hospitals or staffs that don't have the capacity. Right.
Yeah, I think, from what I know of the Israeli system, obviously having a lot of family members in it, I think it's a philosophy. I think it begins with a philosophy change that you want to create the state-of-the-art healthcare system, and that really meets the demands of the future. So when I think about state-of-the-art, I think about things that are very lean, that can move very quick, that can provide the highest level of care for the least amount of cost, and something that provides universal access to everybody to the exact treatment that they need immediately, so that we don't have to wait until things progress to the point of non-recovery. So I think it's a philosophical change. I think Israel has a very antiquated system. You go to the doctor, you have to wait, you see the doctor, you got to get tests, you got to get your results back to the doctor. The ICU is being managed in most cases by anesthesiologists, which are not trained in critical care. They're trained in a ventilator, not critical care. Access to some of the most impressive neuroimaging, other imaging, other drugs and medication. It seems like we're creating them in Israel and exporting them. It's complicated. You got to get permission, you got to get oversight, you got to get approval, you got to have the head of department. The heads of department are quote unquote professors. We don't use that title often. I'm a professor in 3 different medical schools. But the ideal here is that you have to get approval from somebody who probably does a lot of research and probably isn't connected at the bedside, but he knows best, or he has seniority. Right. The telemedicine system is something that bypasses all that. It's something that delivers the best possible care for the least cost. It's something that connects patients immediately. And what we've seen across the board is that, number one, it's an outpatient application, prevents people from coming to the hospital and inundating the system. Mm-hmm. From an inpatient standpoint, they're getting the best possible care. They're getting direction. They're getting a leader on and it's non-political. They're getting the best possible care that can be measured in outcomes, measured in patient satisfaction, measured in terms of reducing the load, the incredible load that it has, financial load that it has on the healthcare system in Israel. And I think it's something that it's proven. It's just to apply it in a place like Israel that needs it so badly. It needs a philosophical change. I realized I was looking at the numbers, but I realized just in terms of sheer scale. So previously, I was a chief medical officer of the Intensivist group of Hospital Corporation of America. It's the largest healthcare organization in the United States, and we managed healthcare systems that are 2 to 3 times the size of the healthcare system in Israel. In fact, just to give you an example, the Orlando system alone is about the size of the healthcare system in Israel. And they have
many of these large systems.
Correct. And they've adopted these applications, number one, out of need, and number two, because it just made sense and break down the barriers. And I'm confident that these systems are ready for the next level of care. You know, it's the way it's not just non-political. It's nothing to do with, you know, who's the smartest, who's been there the longest. It has to do with, you know, having a nimble system that delivers the best possible product. And I think being in the private sector makes a big difference, because then you're pressed. You know, there's competition, and you're pressed to get the best that you can. But Israel for sure could benefit. I mean, beyond words, can benefit.
I think most people in Israel don't know that the life expectancy when you're outside of the Tel Aviv Jerusalem area, the center of the country, is about 4 years less than the center, and that's because of poor access to care, poor critical care. And you know, I agree with you. I'm going to move on to the next question, which is: do you have any message for the people who believe that the data is being manipulated, that this is a hoax, this is a politically motivated situation? Do you have any sort of message for them? And my feeling is that people who, you know, I agree with how you said it's black and white and it shouldn't be, but that when people decide, that they don't want to get a vaccine, they don't believe in it, that anything that they do, anything that you approach them with that is fact, they're just going to say, well, that doesn't meet the criteria that I have. So it's they want to believe what they want to believe, and you could prove from here to, you know, forever, and it's not going to make a difference. But I would like to hear if you have a message for people who are like that, who are, you know, end up in your ICU.
Yeah, I mean, people make decisions for them individually. They can believe whatever they want. There's a lot of people up there that believe that you know, the world is a giant spaceship. It's the way it is. There's all these conspiracy theories. You know, they're the power for somebody to feel empowered, to say I'm better than you, I'm smarter than you, I know what's going on, and to create divisions in society. It's incredible. People will believe anything, literally believe anything, no matter what happens. They'll believe that that they can walk on water and or whatever. The most outrageous things that have no scientific basis. Actually, some of it's politically driven. There's no real comment for that. It's just what it is. I will say that, you know, that these are the observations. This is what's actually going on. I had an interesting person that came to illustrate another point. Somebody had come over to me who was vehemently against the vaccine since the beginning. He would give me articles. Like, obviously, you know, it's not something I can read, but he's vehemently against it. I found out just a little while ago that he had gotten the vaccine. I guess he told somebody secretly, didn't want anybody to know, but he actually got it. So I went over to him and I said, I heard you got the vaccine. He's like, yeah, I don't want to make a big deal about it. But I did. My kids, whatever, I did. And he's like, are you happy? I said, I don't, one way or the other, I don't care. It's your decision. It's unfortunate for all the people that are misled by themselves, by other people, by false reports. It's beyond unfortunate, you know. But I was thinking about it afterwards. You guys realize the impact that you have to those folks who don't believe in it. The impact you have on other people. And we're also a nation where people follow other people. We watch other people. We have sort of that social connection. We learn from other people's actions. So you've gotten out and you've publicized that nobody should get it. You know, so many thousand people probably didn't get it because you said so. You know, any of those people died because you said so. So their blood is on your hands. I mean, these are all preventable deaths, potentially. And even if there are people that say, well, how can you prove that it's preventable? I mean, I don't want to continue to have this discussion. But I would tell you that the Parsha just told us, what does that mean? It means that, like, better that you that you watch yourself carefully and you say, you know what, I'm willing to get this because you know what, if there's a small chance it'll seem life, and so be it. And that's it. And, you know, and the other stuff you just have to ignore. I mean, why would, you know, you want to know about information, go to you know, just look around you, just go to a reputable doctor. Go to somebody that gives you advice. You know, I'm vaccinated. All my kids are vaccinated. I could never imagine. I don't know if pretty much my whole family is vaccinated. But it's this is of a crisis situation.
It seems to me from this conversation that the people who pay the price, besides the people who end up unvaccinated and getting sick and dying in the ICU, but the doctors and nurses are paying a price. And then when someone has that heart attack and comes to the hospital and they need an ICU bed and nothing to do with Corona, there's less resources available for them. So everybody is really paying a price. Am I right?
Right. And there's the burnout thing. You know, it's an anger, there's certain anger that exists, a very real anger, frustration, because you're putting other people at risk. Okay, you didn't get the vaccine, and now you have Corona. Now you're coming to the ICU. And every time you take a breath, because you decided that you didn't want to get the vaccine, you're spewing COVID all over the place. And our nurses that did the right thing, got vaccinated, are getting sick, and they're calling out. So now I want you to imagine I have 6 patients in the ICU. It's never 6. It's probably 60 or 80. Let's say it's 6. Okay. All of them are sick, are just incredibly sick. You have 3 nurses, and each nurse is taking care of 2 patients, going back and forth, dealing with everything to keep them alive. And one of them gets sick. She's out. Who's going to replace her? Nobody. There is nobody to replace her. One of my colleagues got sick this week, and there's nobody to replace it. Just get a replacement. There are no nurses. There are no doctors. And you know what? There's no law that says that we have to go. I can decide today, you know what? I don't want to go to work there. And that's just the way it is. So it's fatiguing. It's fatiguing. Yeah. It's sort of very bad decisions. And I think, I mean, I'll be honest, I think there's a level of stupidity. Stupidity that somebody with any level of intelligence can make that kind of decision, that could really think of themselves and their ego and their own needs about everybody else. Look, I had a conversation with somebody recently, and he was talking about why I shouldn't get in. I should get in. I weren't. So I with every single sentence. And I said, I'm not asking you to get it for you. I'm asking you to get it for everybody else. Because you're walking around and giving it to everybody else, and you're going to kill somebody there. You know, it's a terrible situation. But I think if we, terrible situation, and we're, the docs are burning out. So.
Well, listen, I really appreciate you taking the time to speak to me before Shabbat. I really appreciate it. And I hope you are able to rest. And we'll be speaking to you again. It's very enlightening to hear directly from the war zone. Thank you very much.
Yeah, keep praying for us and make the right decisions.
We will. We definitely will.